All right, hello everyone. My name is Dr. Halbert. I am an OBGYN with MemorialCare. I have the pleasure of speaking with those that are here and online about how to plan for conception, hence preconception planning lecture. So thank you for everybody for joining, and I hope that I get to answer some questions for you, and if I don't address it during the lecture, please feel free to ask it at the end with a question and answer session. All right, so let's get started. All right, well, here's me, and a little bit about me. So I have some training in mental health disorders. That was one of the highlights of my residency, and I did my big research project on postpartum depression specifically, so I'm very passionate about that. I got a lot of training on high-risk pregnancies, and then as well as PCOS and fertility. Some of these things are going to be later on in life for women in the room with hormone replacement therapy and pelvic floor prolapse. And then I'm also robotically trained, and I do a lot of minimally invasive gynecologic surgery as well. So full scope, but I have a special place in my heart for pregnancy. So our agenda today is we'll talk about why it's important to plan for both the male and female partner for the pregnancy, the reproductive and overall health, why family history review is important, social and mental health, diet, nutrition, and then maternity at MemorialCare. So why plan? So there's a lot of data that looks at what you do before pregnancy is just as important as what you do during pregnancy. Unfortunately, a lot of times we miss that window to optimize our health before pregnancy, and then kind of have to play catch up in the beginning of our pregnancy care. So it's good that you're here to plan so that we can optimize your health in order to have a successful pregnancy right off of the bat. 45% of pregnancies in the United States are unintended, and so those especially miss that good window. So it's really good that you guys are here in order to talk about it and plan. So benefits of preconception planning. So like I said, it's ensuring a healthy start for you and your child, optimizing your health. We are reducing the risk of adverse pregnancy outcomes, those being gestational diabetes or diabetes in pregnancy, high blood pressure, preeclampsia, preterm labor, miscarriage, stuff like that. Preconception planning also helps to identify and manage chronic health conditions that you might have pre-pregnancy, diabetes, high blood pressure, asthma, lupus, seizures disorders, anxiety, depression, the list can go on and on. Promote a healthy lifestyle for you and your partner. We'll get into that in a little bit. And then increase your readiness for pregnancy. Identify areas that we might need to learn about more and have conversations with your OBGYN, pediatrician, people in your community, etc. So talking about reproductive and overall health. So for women and for men, it's important to have a checkup with your provider where we can review your medical history, see if we need to do any screenings for diabetes or high blood pressure so that we can optimize you before pregnancy. Perform a physical exam that kind of falls into that. Assess current medications. So for men, any type of steroid or testosterone that you're taking, and there's a myriad of reasons why you might be taking that, but that can reduce the chance of pregnancy because it does alter sperm count and sperm motility. So coming off of those or talking with your provider about alternative ways that you can get that same effect with maybe a different and safer medication is ideal. And for women, there's a lot of medications that might not be safe in pregnancy. And so getting to a better choice for you would be ideal. And then there's many herbal supplements that are not safe in pregnancy either. And so writing down what you're on and talking with your provider is really important. And then ordering any tests or screenings. So A lot of this would be like your A1C, checking your blood counts, checking your glucose, all that kind of thing. For women specifically, it's really important to take a prenatal vitamin at least 3 months before trying. The reason being is that that allows your body to build up stores of all of the essential nutrients and vitamins and minerals that are in that prenatal vitamin. You want to look for vitamins that have folic acid and iron in them. So this is kind of a hot topic, is that folic acid part. There's a lot of celebrities that have come out with these designer prenatal vitamins, which are really expensive and have gone to methylfolate instead of folic acid. Methylfolate has not been well studied in pregnancy, as well as folic acid. And so American College of OBGYNs recommends folic acid and does not recommend methylfolate. So make sure when you're looking to get one that has folic acid, and you don't have to spend a lot of money on a prenatal. Prenatals can be covered by insurance, and a lot of times the simple over-the-counter one is the best way to go. And then schedule an appointment with your dentist. So periodontal disease, so that's basically gum disease, has been linked to preterm delivery. So optimizing the oral health is helpful for successful pregnancy. Going more into overall health, and this applies to men and women in the room. So for smoking, this is tobacco as well as marijuana. So for smoking, it decreases the sperm count and motility in men. So really there's no safe level for tobacco or marijuana use. Same for women. Smoking causes hormonal imbalances and ovary damage, as well as, so I just kind of want to go a little bit on a sidebar here, but there has been studies that have looked at marijuana use in pregnancy, and that has been shown that it increases risk of learning deficits in the baby all the way up throughout their school years. So no level is safe. And smoking for women, even in early pregnancy, increases the risk of preterm delivery and small babies later on in pregnancy. We'll start with caffeine. So large amounts of caffeine is associated with a lower chance of conceiving, higher rate of miscarriage, and low birth weight. These are like excessive amounts. I'm talking multiple Celsiuses a day, multiple days in a row, not an occasional, wow, my work's going late, I need to, have an extra coffee. This is hundreds of milligrams, multiple days in a row, consistently. Alcohol, there's been no proven safe alcohol dose in pregnancy, so it's especially if you're trying to conceive, we recommend avoiding alcohol. And alcohol causes toxins in your body, which increases the rate of miscarriage and potentially decreases fertility rates. For staying active, so being active before pregnancy helps with our cardiovascular health, our overall, mental health, and it helps reduce the risk of gestational diabetes, high blood pressure, preeclampsia, and pregnancy. One of the questions that I get asked a lot is about advanced maternal age. So this is a very flattering term that we give to women who are 35 at time of delivery, not at time of pregnancy. So having advanced maternal age increases the risk of fetal chromosomal abnormalities. So this would be things like Down syndrome, some of the other trisomies like trisomy 13, 18, things that are similar to Down syndrome. It also can cause early pregnancy issues like spontaneous abortion, ectopic pregnancy, and then in late pregnancy, high blood pressure, gestational diabetes, placental problems, dysfunctional labor, meaning abnormal labor curve, or increased risk of C-section is a better way to say it. So the graph that's on here just shows that as you increase in age, our percentage chance of having a live-born baby with Down syndrome increases. So It's kind of hard to interpret, but basically at age 35, the chance of Down syndrome is 1 in 250 live births. So it's just something to keep in mind. We do see a large percentage of our moms that are having babies right now being in the advanced maternal age. That's just the way our society is going. And there's lots of ways that we can help with screening, etc. So just because you're 35 or above doesn't mean you shouldn't be pregnant. It's just a conversation to have with your doctors and understand for planning purposes. So for your family history, this is really important for both sides because genetics comes from both sides. So understanding what's on the maternal side and the paternal side. Are there any diseases that we think you can pass down? This chart is hard to see, but there's a couple different ethnicities up here, and the incidence of having some of these hereditary diseases in that ethnicity. So for example, for people who are of African descent, the risk of sickle cell or being a carrier is 1 in 10. For the Asian population, cystic fibrosis is 1 in 94, but for the European descendants, cystic fibrosis is 1 in 25. Because a lot of people have a lot of different ethnic backgrounds and they might not know exactly where they're from, what we do typically in the office is screen everyone for spinal muscular atrophy or SMA, cystic fibrosis, and the hemoglobinopathies. So those are pretty much everybody is screened. We also screen everybody for neural tube defects and heart defects, and those are typically done through ultrasound. So the psychosocial issues, this gets into my passion, but mental health is just as important as physical health. So not only should you talk to your provider about my risk of diabetes, my risk of high blood pressure, but also your risk of anxiety and depression in pregnancy. So if you have had a history of anxiety or depression at some point in your lifetime, you're at an increased risk of having peripartum and postpartum anxiety and depression. And about 1 in 4 to 1 in 5 women will have some sort of peripartum, postpartum anxiety or depression. There are many medications that are safe for the treatment of these during pregnancy and if you plan to breastfeed. And I recommend that if it's something that you need, that you stay on it through that whole process. It is very safe for the pregnancy and for breastfeeding. I just want to reiterate that. People who have pretty extreme anxiety, depression, stress, bipolar disorder, a lot of, the myriad of mental health disorders, can experience some adverse pregnancy outcomes just because when people are really anxious and depressed, they might not be receiving proper prenatal care, or they might not be eating properly, exercising properly, and that can lead to increased risk of high blood pressure, preterm delivery, stuff like that. Those are more rare, but can be associated. So this issue is just as important to talk about as really any of the other diseases that we have. And then partner and family support. It's really important to create a community that is supporting healthy lifestyle, healthy communication in order to help you through a very stressful time. It's a great time, but it can be very stressful and it was really impactful to your overall health and mental health, etc. So we kind of talked about this a little bit, but substance abuse, so like we said, alcohol, there's really no safe level, so we just recommend that it not be used during the time that you're trying to conceive. And no, like I said, no safe amount, so alcohol use has been linked to fetal alcohol syndrome. For tobacco, so this can be cigarettes or vapes has been linked to miscarriage, preterm birth, low birth weight, and stillbirth. So no amount is safe. And then marijuana, like I said, not only does it impact fertility rates, so if either the female or male partner is using marijuana, you can have decreased fertility rates. And then during pregnancy, preterm birth, low birth rate, and potential effects on fetal neurodevelopment. So definitely, I would avoid all of those. I get asked this pretty much every prenatal visit at the beginning, which is really important. So foods to increase, obviously, things from the earth, plant-based diet, fruits, veggies, low-fat dairy, don't need to cut it out because fats are very important for our overall health. Fish is really helpful because they're high in DHA. DHA is essentially not really a vitamin, I'm blanking on the word, but it's very essential for the fetal brain development. So if you're not a big fish eater, I would look for a prenatal vitamin that has DHA in it. And then these are a list of the fish that would be good to eat. If you notice, these are all at the kind of low end of the food chain. For fish that you want to avoid are ones that are at the high end of the food chain, and that's because the more fish that they eat, the higher up they are, the higher levels of mercury. So these are like shark, swordfish. Tuna is not on there, but has been associated with high levels, etc. We want to avoid raw or undercooked meat. That includes fish. So we live in Southern California. We all love sushi, but that was something that we avoid in pregnancy. Deli meat, because it has listeria. It's a bacteria that can cause pregnant women as well as the fetus to be sick. And then unpasteurized dairy products. We used to say soft cheeses, but really it's just unpasteurized. And truly, not many cheeses in the United States are unpasteurized. But just make sure before you eat it that it is pasteurized. For weight, so we want to achieve a normal BMI. So once we get into the obesity category, which is a BMI of 30 and above, we increase the risk of birth defects, preeclampsia, which is a high blood pressure in pregnancy, gestational diabetes, macrosomia, that means big baby, and stillbirth. And it also has been linked to difficulty conceiving. The chart is really helpful, so it tells you, based on your starting BMI, what's your recommended weight gain in pregnancy. So let's say you are a normal BMI, so between 18.5 and 24.9, you should gain between 25 and 35 pounds. If you're in the obese category, so 30 of BMI or greater, you're looking more at 11 to 20 pounds. We do not recommend weight loss in pregnancy. Exercise. So mild to moderate exercise, it is not harmful for your baby. Whatever you're doing before is usually safe to continue, with the exception of a couple things. One, we don't recommend changing atmospheric pressure, so don't go scuba diving or skydiving. We also don't recommend anything that's going to increase risk of injury, so like contact sports, downhill skiing, horseback riding, I would avoid those. Another good one to avoid would be like hot Bikram yoga. That increases your core body temperature to an unsafe level, so we try to avoid that. But normal exercise is usually okay and very beneficial for your overall health. Start a regimen before pregnancy and continue it through pregnancy to decrease your risk of gestational diabetes, high blood pressure, and C-section. Caffeine, you could definitely continue caffeine during pregnancy. We recommend no more than 200 milligrams per day. That comes out to be about 2 6-ounce cups of coffee or 1 Celsius. So we don't recommend like a ton of caffeine intake, but 200 milligrams and less is okay. For conception, so I will get asked this a lot, so how can we increase our chance of conceiving? So the number one tip I would say is to figure out when you're ovulating. If you have 28-day cycles from first day of your period to the next first day of your period, you're usually ovulating around day 14, but everyone is different. So talk with your doctor about how to figure out how to know you're ovulating, whether that be a blood test that we do or fertility LH test strips. And then intercourse 1 to 2 days prior to ovulation and day of ovulation typically is the most fertile window. For timing of intercourse during that window, so the optimum semen quality is when you have 2 to 3 days of abstinence. So having no intercourse for 2 to 3 days before the ovulation window gives you your best shot. And then the highest pregnancy rates occur when couples have intercourse every 1 to 2 days during ovulation. You do not need to have intercourse every single day during your fertile window. Every 2 days has been proven to be just as effective as every day. It just depends on your schedule, your lifestyle, and what works for the particular couple. These things have no effect on conception. So coital position. So no matter what position intercourse is taking place in does not affect pregnancy rates. Whether or not the female orgasms does not have any effect in activity after intercourse. You do not need to, let's say, lay down for a certain amount of time, avoid things after intercourse in order to make sure that an egg is fertilized. And sperm can last in the female reproductive tract for up to 5 days. For lubricants, so canola oil, mineral oil, and then like pre-seed, these are safer. Avoiding more of like the water-based KY jelly, Astroglide, and that is just because the latter three have been shown to affect sperm motility more than the ones above. Truthfully, if you're able to use no lubricants during intercourse, that will be your best bet, but if you have to, I would use the above. And this is a fun planning. So depending on when you would conceive, when your due date would be. Obviously, things change depending on if you go into labor early, you need to be induced early, etc. But generally, let's say you conceive in January, then the baby would be born in October. And then here's some information about maternity care at Memorial. So we have 10 OBGYNs and 3 certified nurse midwives in the South Orange County region, and these are our locations. We work very closely with nurse midwives. Our nurse midwives are excellently trained and are really good at helping with more of like the natural labor, as well as abnormal labor if you're wanting epidural, all of that kind of stuff too. But it's a great addition to our team, so I'm really happy that they're on board. And you're able to see, if you want to come to us, you can see an OBGYN, you could see a midwife, or you can see a combination in our offices. So this is my office. I work in Rancho Mission, Viejo. I work with Dr. Faraz, she's amazing, and a physician assistant, Annalise Mariner. And so we're right off of Ortega Highway. Our office is brand new, it's beautiful. So we would love for you to come and see us. But there also is our colleagues that are in this building as well. The Women's Hospital, so it's beautiful. It's been completely redone. We have private labor and delivery suites, recovery rooms, and postpartum suites. They look like you're in a hotel. They've got a really cute like Himalayan salt lamp in the corner. They have done a really good job. They've got an amazing shower with these beautiful shower heads for helping with pain management during labor. We've got an emergency department for obstetrics. We've got an on-site level 2 NICU, so that's basically like the highest level, well, level 4 is technically the highest, but the only thing that we're missing is something called ECMO, which would be essentially like an artificial heart system and breathing system for the baby. But we can handle most things here. We've got birth classes, mommy and me and postpartum classes, lactation consultants, high-risk pregnancy care with our high-risk maternal fetal medicine specialists, magnet dedicated nurses, and we have 24/7 OB dedicated anesthesiologists. That's really important because our anesthesiologists have done fellowships in OBGYN care, or I should have just said obstetric care, and so they're excellent. Neonatologist and a 24/7 OB hospitalist. So I'll have a little video. So that's our nurses station. There's a Himalayan salt lamp in the corner. Those are newly renovated showers. If they don't show it, there's also soaking tubs on the floor. And this is the emergency room for the obstetric patients. One of our best nurses there. And there's the NICU that is being fully renovated as well right now. Oh, I'm playing it again. And then we have Jessica. Do you want to, should I read this or do you want to introduce yourself?
My name is Jessica Ayala. I am the maternity concierge. So my role here at Saddleback Medical Center is to be that individualized support for patients who are looking to deliver at Saddleback Medical Center. So by the time that you register, I'm there to be of that support, help answer any questions. You want to learn more about the hospital, schedule a tour, maternity classes. If you're let's say even before you've registered and you're wanting to find a provider, you're looking for prenatal care, you're welcome to reach out to me. I'd be happy to get you connected to our physicians on staff. So I'm just there to be of that support until the day that you deliver. So more information available on the website and business cards as well. So thank you so much.
Thank you. All right, well, thank you. I'd love to hear from those in the room and those online what questions that we have.
Infertility.
Great question. So for those online, the question was, how do I know when I need to seek support for infertility? So typically we recommend, well, let me back up with some statistics. So 85% of couples will achieve pregnancy within 1 year of trying or unprotected intercourse. And each cycle, or I guess cycle is a good word, is about 15 to 25% success. So if you are a statistician or not, anyway, it typically comes out to 85% in a year. So we recommend that for people who are less than 30, that you try for a year before we would send you to the reproductive endocrinologist and infertility specialist. That doesn't mean you can't speak to your OBGYN sooner and do investigations, but we reserve referral to what we call REI, like the equipment store, that specialist at a year. Over 30 years old, we typically recommend 6 months. At that 6-month mark, we send you to REI. And then obviously if there's a history of anything like a partner has a vasectomy reversal, or there's other things in the history that are more, I would say, outside of the norm, then we would send you earlier. What else? Yes?
Do you have any recommendations
Oh, good question. So the question is a recommendation for prenatal vitamin. There is not a specific brand that I typically recommend. However, I would choose one that is cost efficient. You don't need to spend $50 a month on a prenatal. One that has 400 micrograms of folic acid and DHA. So I think there's one that's like, I can't even think of the name right now, but there's it's like one of the most common vitamin companies. It's like I want to say like a yellow bottle with like a brown top maybe. Yes, they have, Nature Made, yes. They have a prenatal that has, I think it's like, you can get it on Amazon. Not that I'm endorsing Amazon, but Amazon, that's like $15 for like a 90-day supply that has 400 micrograms of folic acid and DHA. What else? Yes?
Do you have recommended anything like that?
Great question. So, I wish I had a better answer for you. I would say that the best thing to avoid is any retinols. So even just like over-the-counter retinols are not safe in pregnancy. So I would take that out of your skincare routine if you're trying to conceive. And then just try to keep, your daily routines as clean as possible. In terms of like brands, I don't really have like a one that I would recommend. A question I get asked a lot is, can I dye my hair and do my nails in pregnancy? There's really no good studies for or against that. I would say that if you're going to, then just try to limit exposure of like the chemical smells. But I have worked with many high-risk OBGYNs that say, go ahead, you can get your hair and nails done in pregnancy. What else?
Or would you speak to your gynecologist or something?
Great question. So the question is, when should I get screened for some of those hereditary diseases that you can pass on? So like the cystic fibrosis, spinal muscular atrophy. So ideally, this would be something that you do before pregnancy, because we offer it for everybody during pregnancy, but at some points that could be, depending on what your goals for are in pregnancy, it could be, too late. So let's say, for instance, we screen you for cystic fibrosis. We screen let's say I have a female patient who comes to me. I would screen the female patient. If she's positive, I would screen her partner. If they're positive, then you've got a 25% chance that an offspring will have, let's say, cystic fibrosis. So if those are unacceptable odds to you, then I would send you to an infertility specialist for IVF, where they could make sure that the embryo that they're transferring is free of those diseases. That's what you could do before pregnancy. If you're currently pregnant, we still screen. And the reason why being is because we'd want to know if the current pregnancy is affected and steps that we can take to ensure that we've got a whole care team and delivery team that can help with the needs of that pregnancy. So ideally, it would be before. I have a lot of people who come see me for preconception counseling, and that's something that I order routinely. And that way we make sure that we're not missing anything, and then if it's positive, then we can screen the partner.
Does insurance usually cover?
Great question. Yeah, so question is, does insurance cover that? A lot of times they do. We use LabCorp through MemorialCare, and they have a special program where they are able to screen the partner or the patient and the partner. I think that like if there's no insurance coverage, and I think they told me like 99% of the time there is, if there's absolutely no insurance coverage, I think the tests, all three of those tests and the partner's test was around like $300. So not like, it's expensive, but it's not astronomical. Yes?
Do you have an ovulation test or fertility tracker that you recommend?
Great question. So the question is, is there an ovulation tracker that I recommend? I think most of them are are good. There is one that I have found that people have good success with. Again, it's on Amazon. I'm not getting any like kickbacks from this, I promise. But there is on Amazon. It comes in a pink box with a baby on the front with like a blanket over its head, and it's LH test strips and pregnancy tests. I think it's like $30 for 50 LH strips and 25 pregnancy tests or something, so pretty reasonable. And it comes with an app on your phone that you can actually take a picture of the strip and upload the results, and it helps interpret them for you. So I've seen a lot of people like that, but truly I don't think there's just like a specific one. One thing that I will say, if you have a history of PCOS, sometimes the LH or ovulation test strips at home might not be effective for you just on how your hormones are. And so you'll probably need to work with your doctor to either get blood tests or do the basal body temperature tracking at home. What else? Yes, please, keep them coming.
If you've been on birth control for a really long time, is there a certain amount of time you recommend people to be off it before trying, or just stop taking it and
Yeah.
go for it?
So the question is, if I've been on birth control for a while, can I just stop my birth control and try, or should I wait a certain amount of time? No, you can just stop and start trying. And that's truly the same for all forms of contraception, whether that be birth control pills, the Nexplanon, which is an arm implant, an IUD, the NuvaRing, any of those, on the Depo-Provera shot. Out of all of them, the one that takes longest from stopping to conceiving is typically the Depo-Provera shot. The rest are quicker, usually conception in the first few months, or ability to conceive within the first few months, I should say. And none of them increase birth defects or decrease pregnancy rates. It doesn't matter how long you've been on them either. You have more questions?
That's not all my questions. That was my next one.
Yes.
Question about SSRIs in pregnancy use.
Mhm.
Obviously, like mental health is a
Absolutely.
big, topic of conversations. Are they safe? Are some safer than others?
Yeah, great question. SSRIs are very safe in pregnancy, and that is the number one medication we use for anxiety and depression. That was actually what my research was on in residency, is looking at the rates of use and the safety in pregnancy and postpartum. So the safest and most well-studied SSRIs are Zoloft, which is sertraline, and Lexapro. Those are like the safest. I believe, now that you put me on the spot, there is one, and I think it might be Paxil and paroxetine. I think that's the one I'm thinking of, that has been shown to increase heart defects. So we don't recommend that one, but the rest are very safe and they do not. If you Google SSRI use in pregnancy, one of the first things that might pop up is what we call neonatal abstinence syndrome, or the idea that a baby who's exposed to an SSRI or an SNRI during pregnancy might have withdrawal symptoms once they delivered. The study that I did, and it's not been published yet, so take that with a grain of salt, but my review of a bunch of different studies have looked at the actual risk of that, and it's extremely low. So if you take, and the risk of withdrawal for the baby, or the withdrawal symptoms, are more fussiness and potentially increased risk of difficulty latching in the first few hours, but all of that together is extremely low. And in my study of a couple hundred people, no babies had those symptoms. But then you look at the number one cause of maternal death in the United States, which is maternal suicide. And I think that the risk of coming off those medications and going untreated is significantly and far worse than any theoretical risk of an SSRI or SNRI. So if it is needed, I absolutely would recommend that patients be on it. It was something that I would put my sister or best friends on. I would say, you need to, if they need it, keep it through pregnancy and postpartum. And there's other, medications that are used for other things, like if people have bipolar disorder or other mental health disorders that, they don't use SSRIs. There's many different medications that are safe, but for specifically anxiety and depression, SSRI is the safest. What else? Go ahead.
You're looking at me.
No, I don't.
Cleaning products. Is there anything that people might use on a daily basis that might have like microplastics, or I don't know, something you shouldn't have necessarily while you're trying to conceive or pregnant? Is there anything like that?
That's a really good question. So the question is there any cleaning products that you should avoid if you're trying to conceive? I don't know the answer to that. Something I'll have to look into. I think just trying to be as safe as possible with like avoiding like harsh chemicals would be the best. But yeah, I don't really have an answer. I will say that the one thing that I do know is if you have a cat, try to avoid cleaning the litter box during conception and pregnancy. That causes an increased risk of exposure to a bacteria called toxoplasmosis, which can cause birth defects. So I've tried to avoid cleaning of the litter box during like conception and pregnancy. You have really good questions today. I need to look at the answers to them. Any questions from, here, yes, please.
Are there any prenatal vitamins that a male should take to help with sperm motility or effectiveness?
Yeah. So the question is there anything that the men should take for sperm motility? I would say that the best one and most well-studied is a over-the-counter supplement called coenzyme Q10 or CoQ10. Really no specific dosage, just whatever you can find over the counter. Females can actually take that as well. It's essentially a natural antioxidant, so it helps with egg and sperm quality. So if you go to a reproductive endocrinologist and infertility specialist, that's one of the first things they'll tell you is both parties to take CoQ10. Any questions from our online friends? No? Okay.
Is there anything else that the men should be doing? Mine didn't.
Yeah. So for men, so a fun fact about sperm is that whatever sperm is present today and like on the, lack of a better term, like conveyor belt to be used today has been made 3 months ago. So thinking back to 3 months ago, well, whatever we were doing 3 months ago that's the sperm that is now being used today. So trying to like look forward, whatever you do today is going to be the sperm that comes in 3 months. So for overall sperm health would be avoiding anything that can cause excessive heat to the testicles. So like avoiding consistent sauna, hot tub, spa use, having more, like looser underwear. So like the boxers instead of like the briefs. Avoiding excess alcohol, marijuana, tobacco, doing the CoQ10, and then the other one that has been shown to potentially decrease sperm counts is like excessive bike use. So, I mean, if you're going out on your bicycle every once in a while, or Peloton or whatever is okay because that's healthy, but like if there's like consistent pressure on the testicles, that could potentially decrease sperm counts. But I would say other than that, not much. Yeah, there's a question online.
Yeah, one question is it true you can't eat sprouts or mayo while pregnant?
Oh, great question. So question, can I not eat sprouts or mayo? I'm not sure about mayo. I guess it would make sense because I think it has like eggs in it, right? Raw eggs. So yeah, so I guess avoiding mayo. And then yes, sprouts can harbor listeria as well. And that is like microgreen sprouts on your sandwich, as well as like the bean sprouts when you get pad thai. So avoiding those two. Yes.
Do you have any thoughts on natural birth, especially like in the medical setting?
Great. So what do you mean by natural birth?
Like without like an epidural, say.
Gotcha. Yeah, so the question is, what are my thoughts on natural birth? I think every individual is different. And so if natural birth is something that you are passionate about, absolutely. And then if you're super passionate about it, I would recommend seeing one of the midwives, and they're extra trained on different birth positions that would be helpful, and overall like a more holistic way to help with that. Me as an OBGYN doesn't mean that I'm going to push, and really nobody in our group is going to be pushing a medicated birth on anyone, or C-sections by that matter. We really try to get everybody delivered vaginally safely, in an experience that you want. I would say the one thing that I am very strongly opposed to is home births. I know that is a very big thing right now, but I cannot tell you how many times I have had a patient who has had the most beautiful pregnancy, uncomplicated, super healthy, super fit, done everything right, come into labor and delivery, and end up with an emergency C-section to save her and the baby's life. And so I don't like taking those chances at home. I've seen that happen way too many times for me to feel comfortable recommending a home birth. But in terms of like a natural birth, in a hospital setting with resources or access to care, I have no problem with, and I think that is something that we can definitely in our group help you with. But yeah, nobody's going to force a epidural on you. Is that a question in the group chat? Oh, we're good? Okay. Yeah. Any other questions? Yes, please.
There was a slide where there were certain like herbal supplements to avoid. What are like the most common ones?
Common. I would probably recommend against over-the-counter DHEA. That is technically a hormone, and that can cause imbalances. I would avoid St. John's wort during pregnancy. Excessive levels of vitamin A. So just like the normal amount that's in a prenatal. One thing that this is not your question, sorry, and I didn't repeat the question, but the question was, what supplements should I avoid? So I said DHEA, excessive vitamin A, and St. John's wort. One that I would recommend is vitamin D, that is typically found in prenatals, but I would, at your prenatal visit, or preconception visit, talk with your doctor about screening for vitamin D deficiency, because vitamin D deficiency has been shown to increase miscarriage rates as well as decrease fertility rates. So getting you up to a normal level, and sometimes that means having additional international units beyond what's in a prenatal vitamin. Sorry, we have one here. Yes.
Are there any exercises that you recommend to do while pregnant?
Great question. So the question is, what exercises are recommended in pregnancy? Really, anything that's getting your heart rate up for 30 minutes, at least 5 times a week. So those would be, I mean, even walking's okay. Jogging, biking is great, just not toward the end of pregnancy, I would say, just because your balance is going to be like really off and increased risk of falls. Yoga is great and has been shown to help with vaginal delivery rates, just because you're helping relax the pelvic floor. Core exercises can be difficult in pregnancy because you have what we call diastasis. You've got abdominal muscles from each side that come together in the middle. That's why there's that line for people who have the six-pack. So that line starts to separate. So you have less core strength. So having don't do P90X core exercises during pregnancy. I would not recommend that. But anything that's strengthening your lower back, relaxing your pelvic floor, so mostly like yoga, walking, jogging would be the best. And then what was your question?
Do you recommend avoiding any herbal teas?
Avoiding herbal teas. Do I recommend avoiding herbal teas? Sorry, I wanted to repeat it for the people online. I don't recommend avoiding, except for there is a tea that's called raspberry leaf tea, maybe something like that, that has been marketed for helping people get into labor. So there's the problem with herbal tea, or not necessarily herbal teas, but really any supplements, is that we don't have great data because the FDA doesn't regulate them. So we don't know exactly how much supplements or herbs go into things. So the data on does raspberry leaf tea help you go into labor? I don't know, but let's say it does. I would not recommend starting that until your term, because I would hate for something to happen and we now induce a preterm delivery. But other than that, no. Yes?
Are there any studies showing the effect of organic versus non-organic produce during pregnancy?
Is there any studies showing non-organic versus organic in pregnancy? I would say not specifically in pregnancy, but there are studies coming out that that look at organic produce specifically for overall health. There is something that's been trending on social media. I want to say it's the hashtag dirty10 or something. Then there's, I could be saying the wrong number, but something like that, where there's, I think 10 foods that should be bought in organically. I want to say an example is broccoli. I don't remember anything else on there, but I would look at those and then try to buy organically in those food groups just to decrease exposure to pesticides. I think that in the next maybe more than few years, but I think more will start coming out about pesticides use and stuff like that as we learn more. But since we don't have a lot of data on that right now, I would try to stick with organics in that area. Anything else? All right. Well, thank you everybody for the opportunity to talk with you about one of my passions. This MemorialCare group is excellent. I would recommend any of the providers in our group. And so we look forward to seeing you and helping you along with your pregnancy journey.